Good morning, Viola.
Good morning, Sakina. Today we are discussing magnet hospitals. This is Nursing 611 Health Systems Management. Sakina Alston and Viola Pierce are in a group together with Dr. Hick as our instructor.
Okay.
So the history of the magnet hospital, which is kind of interesting to me, is that years ago in the 1980s, there was a small group of nurse leaders who got together, and they wanted to try to understand what to do about the nurse shortage, because there was a nurse shortage that was going on. And so what they did was they pulled together their resources and they went to the hospitals or spoke with the hospitals that were attracting the nurses and the nurses and retaining the nurses. Because in order to do something that is great, why don't you go to the people who are doing it that's great? And so what they started to learn was the methods, what they did in order to retain the nurses. So the utilization of the word magnet, which basically means that they are able to pull the nurses in. So Dr. Margaret McClure, she at the time was the president of the American Academy of Nursing. She published a book called Magnet Hospitals, Attraction and Retention of Professional Nurses. And then, as years went on, there were several studies that were conducted. And then in 1994, the American Nurse Credentialing Center started the magnet recognition program. And this was something that didn't get off initially, but as time went on, it became something that hospitals started to recognize as an influential recruiting tool. Now, the application fee in order to obtain magnet status is about $13,750 for a 100-bed facility. So, and then also at that time, prior to 2013, the nurse leaders between the managers and the CNO had to be, 75% of them had to have the baccalaureate or higher degree. After 2013, it was required for all the nurse managers, between the nurse managers and the CNO, to have the baccalaureate degree or higher. There's also other things that came about as a result of that, was that you had to have an educational requirement table, which all that means is that every nurse in your organization, they had to have a table that told what their degree, their height of their degree is, whether it's ADN, whether it's baccalaureate, whether it's master's or doctorate. Protective feedback procedures. So, I guess maybe in previous days, whenever someone would sort of, see something that was going on that was not optimal for patient care, they would say something about this. And so they were protected in their feedback so that they were not penalized for that, for saying things about what was going on that was not so optimal for patient care. And then the compliance with government regulations, which that, of course, that includes Centers for Medicaid and Medicare Services, and also JACOB.
Okay. So the characteristics of the magnet designated hospitals, there are about 5 core components, and then there's one component that encompasses them all. So transformational leadership is one, structural empowerment is another, exemplary professional practice, new knowledge, innovations and improvements, empirical outcomes, and global issues in nursing and healthcare encompass all of those things. Here is a concept map that was developed to just provide a visual of the 5 components encompassed by the 6th one. So the ANCC, American Nurses Credentialing Center, commissioned an exploratory study where the magnet appraisal team scores from 2005 were statistically evaluated, and they revealed these themes for topics associated with improved patient outcomes. There were about 14 themes, and then those themes were later refined to become the foundation for the magnet model components, what we have left here. So there's a list, and you can get a list of magnet hospitals from the ANCC website, and Vidant Medical Center is one of the magnet hospitals that I've worked at. They got their magnet status in 2013, and so I was working there as they were trying to ascertain that magnet status. So I'm going to try to explain a little bit about what I saw of how they exemplify these components. So for transformational leadership, they encourage and provide opportunities for nurses to become certified in specialty areas, so that broadens the nurses' knowledge base, and as an aggregate, all of the nurses have more expertise. They have academic partnerships with credentialed schools of nursing, including East Carolina University. They also have these partnerships with area community colleges. So that always brings new knowledge and promotes knowledge sharing. And so it's helping to develop future leaders that will be able to visualize and guide people into future ways of nursing. And the healthcare system is very, used to be that leaders were to stabilize, and now leaders need to be able to work in an environment that is not stable, and they need to be able to adapt to the changes. So structural empowerment. So that involves having being active in the community and safety initiatives, philanthropy, flu clinics, home health follow-up, visits, and other community events and presence, like measuring for helmets for the kids and making sure that babies that are born in the hospital or come to the hospital in some kind of accident go home with a car seat. Just being active in the community, so extending their structure beyond the physical building where the magnet status is. So they also, for structural empowerment, you need to have an ideal environment to experiment and foster growth of professionals. And at Vidant, they have the main hospital, but then they have the heart center, they have the children's hospital, the children's emergency room, and it's a teaching hospital. So it's a great environment. There's a lot of space there, and there's up-to-date technology where they can grow future professionals and share a lot of knowledge. So as far as transformational leadership, the chief nursing officer has to develop relationships with stakeholders and ensure that the nursing strategic plan aligns up with the organization's vision. And this helps, and the CNO and other nursing personnel will help to develop policies that impact the nursing workflow and patient interaction and outcomes. Other community events that Vidant participates in is cooking at the Ronald McDonald House. They teach CPR at public schools, participate in food drives. They just have a huge presence in the community. They also have a RISE program, which is like a clinical ladder for nurses, and it awards points for the nurses participating in any of these community-based events or further in their education, and that can result in increased pay for the nurses, and they become more marketable and they become more valuable to the hospital. So for exemplary professional practice, that it is imperative that nurses, the whole division or aggregate of nurses, understand their role in the patient's outcomes, and they apply the knowledge of that understanding to produce new empirical knowledge and interact with the disciplinary team. So the nurse is always going to, they're always going to be a part of patient care. Even if the nurse needs an x-ray or they need an MRI, then if the patient needs an MRI, then the nurse is going to be the one that does the MRI checklist. So they have to collaborate with radiology. If the patient is going to have some occupational therapy, then the nurse is going to make sure that the patient hasn't had any medications that are going to make them drowsy right before occupational therapy. So the nurse, once the nurse really understands how their interaction with other disciplines affects the patient's care and the patient's outcome, then they can develop these professional relationships and really make them work, manipulate them to make them work for the best of the patient's care. And exemplary professional practice is about what the profession can achieve. So evidence is important. So a lot of data collection, that's like data collection can be labs or recording of triage times or recording of how many readmits the patient has had or how many IV sticks it took to get a line on the patient. So the nurse is always involved in data collection. And once they realize exactly how much information they can pull from that data collection, and then they can share that with the other disciplines in a professional way to improve patient outcomes, then that helps them to show what they are bringing to the profession. Let's see. Then new knowledge and innovations and improvements. So having a current electronic health record that keeps track of all kinds of data helps us to collect the data, and then when we can run reports and analyze the data, then we can come up with some themes and some evidence-based knowledge from the outcomes that we reveal from scrutinizing the data. So Vidant has an electronic health record, and they're collecting data and using that data to grow the students that they have academic partnerships with, the nurses that they have working with the patients, and then using that knowledge to make innovative improvements to patient outcomes. Okay, so leadership skills necessary to achieve magnet status include, the leader has to have a vision where they can see where the future of nursing is going, and then they have to have an influence or a charm even, where they can get people to follow and see their vision and become invested in that vision. They need to have clinical knowledge and expertise in clinical nurse practice so that they can have some credibility, so people will want to follow them, and that they are more influential over the nurses that they are to lead. They need to be professional, and they need to have the confidence to take risks and be first, as this healthcare environment is changing so fast. And they also have to have the confidence to be wrong sometimes. They have to have the knowledge base to survive being wrong. And they must be able to visualize what has not happened yet so that they can take other people there. So, and the outcome of this type of leadership, it usually is nursing excellence. And it will, if leaders can exemplify the core components, they will end up achieving magnet status. So Vidant Medical Center, one way that they ensure quality results, empirical quality results, is that they use a process called optimal care, which derives data from the patient electronic health record about the treatment received for specific conditions. The data is translated into a percentage and compared to treatment rates and methods at other hospitals. The test intends to compare which hospital utilizes the most up-to-date and effective treatments for their patients. Results can be used to make improvements in patient outcomes. Vidant uses this optimized care for several different types of illnesses, such as cardiac issues and respiratory issues, and then they just compare what they're doing for the patients and those outcomes to other hospitals, and then they can make improvements and do whatever works best from the empirical outcomes that they achieve. So
I chose Cedars-Sinai, and what I did was I did some research on the hospitals that have the top 10 hospitals that have obtained magnet status within the last few years. Transformational leadership, the one component of magnet, it shows in their vision, because they attract and they enhance the relationships of the nurses and well-qualified, accomplished nurses, physicians, and scientists, which is key to magnet status. That is one of the biggest things that, you know, we can, it really, to me, in that vision, it really speaks to how they treat the people that are there, because, you know, people don't leave organizations because they don't stay with organizations because of the organization. They don't stay with organizations because of the building. They stay with organizations because of the relationships in which they form. And Cedars-Sinai has this in their vision that they are, you know, they enhance those relationships. They demonstrate excellence in their clinical skills. So, you know, whenever you have excellence in your clinical skills, your patient outcomes are going to be a lot better. Your patient outcomes are going to be so that, you know, your patient comes back and, you know, they're cured from this disease process and they're thanking you. And that's a big thing for nurses. You know, their vision is really, really clear cut as to how they have progressed towards this magnet status. They also have biomedical research. This facility, you know, I looked at the facility and I want to go work there. Can we progress to the next slide?
Okay.
So the new knowledge, innovations, and empowerment. So the vice president and the CNO, they only have one CNO. Her name is Dr. Linda Burns Bolton. She is a doctor of public health. She has been in healthcare, or she's been in leadership for the last 20 years. She actually knew that, you know, she really could. She felt like she couldn't make as much of an impact at the bedside, and so she wanted to progress into leadership rather quickly, and so that's what she did. I had to call in order to find this out because I couldn't find this out on the website, but a large majority of the nurses there had their BSN. I thought that all of them had to have their BSN, but it is not the case. They have to have their BSN or be getting their BSN within 2 years. And so the nurses benefit from a number of educational programs and career paths. They also have this innovative IV pump linked to the electronic health record. And so what happens is that you scan your patient, which then places your order into the mobile device that you have. You scan your pump, it automatically programs your pump so that your pump is automatically programmed. You put your tubing in, and then you have one last step just to make sure that what the pump is reading is right. You know, for these highly vasoactive drugs, you know, I just started a level-fed drip the other day, and the level-fed drip needed to you know, I had to manually put everything in, and so it's just you know, it saves time and it saves steps. So Cedars-Sinai, the structural empowerment is that nursing education is of a high priority. You know, they have a professional development program, which, to be honest with you, because of our professional development program is the reason why I'm even in school today. Otherwise, I would still be at the bedside. I would still be an associate degree nurse. Nurses are encouraged to continue the education. And this blew me away, is that they have free educational program and financial assistance through Jerry and Richard Browerman Nursing Institute. And so they sponsor free on-site baccalaureate and master's classes via Cal State in Los Angeles. And that just blew me away, you know, for you not to be able to pay for your education, which there's a lot of nurses that I see today that have been nurses for a long time, and they say, well, I don't want to go back to school because at the end of the day, that my degree, you know, I won't work long enough for my degree to be paid for. And I think that's just, that, you know, releases that barrier there. And then there's a commitment to improving patient care and health of the community, whereas they have a lot of initiatives where they go out into the community, a lot of philanthropy to the community. They focus a lot on public health management. It is just a wonderful facility. Their exemplary professional practice is that they're the longest running magnet destination in California. They're the first hospital in California to rank in the year 2000. They are one of only 9 hospitals nationwide, worldwide actually, to earn magnet 4 times. They rank number 2 in California for best hospitals by the U.S. News and World Report. They won the National Research Corporation Consumer Choice Awards for the best nurses. They have 886 licensed beds, 2,100 physicians, and 2,800 nurses. They're the leader in clinical care and research for heart disease, cancer, and brain disorders, and they also have stem cell research. So the empirical outcomes, so they report to JACO on a quarterly basis, and it's also shared on their website. And so that, to me, is very, it's leadership is about, it's about a lot of things, but transparency is huge when it comes to leadership. Just being transparent, letting everybody know what your scores are. So the scores are phenomenal when it comes to their pregnancy care quality measures, their immunizations, the stroke care measures, which just kind of blew me away because they are like 98 and 100% across the board on that. And then their venous thromboembolism measures. And then they have this annual report where they literally, they have all these initiatives each and every year. They focus on an initiative, and they do research, and they pull out of that research on things to better care for their patients.
So these are our references, and that was very interesting about Cedars-Sinai Hospital. I can see why they would be magnet status. Do you have anything more to add, Viola?
I do not. Thank you.
Yep. Thank you for listening to our presentation. Have a great day.